Martin Finley. Martin is a junior doctor and a representative from the Doctors Association UK. Thank you for joining us, Martin. Happy Christmas. What do you think of this survey result?
Thank you, and happy Christmas. I'm not at all surprised by it. I think, if anything, I spoke to a friend just earlier today, and he was saying, well, he thought two-thirds was an underestimate. Actually, if you look at it a little bit and read through to the second line, it actually says, I think it's 79%.
Yeah.
We're thinking of living in the NHS. So
well, I think 79% have researched other jobs, but two-thirds, 6 out of 10, have said they're actively thinking of leaving.
Yeah. And I think, in terms of the reasons for that, I think one is pay, and the article mentions that when you start, it's sort of about £14 an hour as a base pay. That assumes that you stick to the hours that you're rostered for, which has never happened in a single medical or surgical job that I've worked in. So your actual hourly pay is probably quite a bit less than that. So that's the first issue. So after tax and outgoing, you'd be better getting cash in hand in a car wash, and after. Yeah,
but you see, if you work in a car wash, Martin, your career prospects are not very high. You're probably going to earn the same, unless you buy the company, for the rest of your career. Doctors' potential earning is huge.
Absolutely. In one sense, yes, there is career progression. In another sense, I think what a lot of people don't realise is that, what you said, and thank you very much for bringing that up, you're considered a junior doctor until you're a consultant or a specialist and able to run a department. Yeah. Now, on average, it takes 6 years to finish med school, six and a half. After that, it takes an average of 14 and a half years to become consultant. So that's a total of over 20 years, 21 years of your life. You're a medical student or junior doctor. That's half your career. So, and then when you get to that point, you start on 78 grand. I think it's up to 80, which is quite a lot of money. I appreciate that. But it takes sort of half of a lifetime to get there. And actually, in comparison, there are a lot of other jobs that pay significantly more. So, for example, when you're talking, especially with people who've got similar grades at university, that's about the sort of level at an investment bank of first year out of university at the age of 20 without their bonus. So I think that's one of the reasons people are thinking... No,
I completely understand. I totally understand the disenchantment with the NHS. And it's not necessarily just the pay, it's the working conditions, and there aren't enough people working in the NHS. There aren't enough nurses, there aren't enough specialists, so there aren't enough physiotherapists, there probably aren't enough cleaners, there's alarming gaps. My only problem with the survey is that if you're a junior doctor, you've gone through, as you say, you've gone through 3 years of uni, you've gone through 3 years of medical exams and training and all the rest of it. If you were going to leave because you were disenchanted with your future, surely you would leave when you were training. To go through 6 years of training and then to say, I'm thinking of leaving, what a waste of time and money.
Well, I mean, it's the training it's at uni. You either drop out mid-uni, which, isn't really recommended. You can drop out earlier and get a degree. A lot of people finish 2 years of medicine. And that's what I've seen with my sort of graduating class. And sort of something like a quarter of people have left to Australia and New Zealand. A lot more have left to other professions, other countries that sort of pay more, especially in London. If you join a consultancy, a bank, sort of, and people like having doctors in, they do sort of pay one, and at times working conditions are better to the point where I had a career before medicine, and I sort of went into the NHS and was very surprised at quite a lot of sort of problems within the NHS that people don't see as problems because they never worked in other fields or in other private companies before. So yeah, that's just something I've noticed.
Do you think that the BMA's asking for is unreasonable? First year junior doctor salary is 29,384. The BMA want it to be 37,000. That's a huge increase percentage-wise, isn't it? You're never going to get that.
It is a huge increase, but I think what you've got to factor in is pay's been frozen for 15 years. It hasn't gone up in terms of house prices and everything else. So we've had sort of a 30% pay cut almost in the last sort of 10, 15 years. Certainly, when I was young, within a few years of being a doctor, within 5 years or so, you could get a mortgage on a house and things like that. And now that's almost impossible for most doctors. The other thing is people get moved around a lot. It's a little bit like the army, where you mid-career, they can send you up somewhere else.
So we've got this ballot in 2 weeks. Do you think the doctors will vote for strike action, Martin?
I think they will. Personally, I'm quite confident that they will. But yeah, that's just my opinion.
Okay, and how will that affect the health service for that day? We've heard that we've seen nurses go on strike. We've seen ambulance crews and call centre answerers going on strike as well. Doctors going on strike is almost another level, isn't it?
It is, but it's important to know this is not. This is also about patient safety as much as it is about anything else. We have significant staff shortages within the NHS and significant hemorrhaging of staff, people leaving, and that causes disruption already. And I think in terms of patient safety, there is a minimum staffing level to maintain that we already have had with the nurses' strike and that we will have with the doctors' strike going forward.
All right. Martin, thanks for your time. Martin Finley, he's a junior doctor represented from the Doctors Association UK, DAUK.